Let's talk about hip pain. I've already shown the hip flexor stretch. Glutes and piriformis are really good stretches for the hip as well. You should have about 45 degrees of internal rotation and 45 degrees of external rotation in the hip, which means that I should be able to push my hip in those different positions. One of the first signs that we see with people with hip problems is when you do a Faber test. You cross your one leg over the other and you drop the knee down. It should be nice and springy and it should go all the way down, and they should be fairly symmetrical. So if you find this one gets stuck over there, it's uncomfortable and it's not so springy when we push down on there, generally it means that you've got early stages of hip problems or some stiffness around the muscles over there. There are a couple of stretches we can do for the hips. For these muscles that turn the hip inwards, you lie on your back, foot flat, put the ankle on the opposite knee, and you're going to try and keep the pelvis nice and flat as much as possible, and you just lower that knee inwards as far as you can go. So you should feel a nice stretch around the outside of the hip over there. Really nice mobilizing exercise for the hip as you slide the heel up, turn it out, slide the heel down. So we do a nice big internal, and you can do them the other way around as well. So we're not putting a huge amount of weight through that. This should be pain-free range of motion only. Don't force this where it doesn't want to go. Even if they're just little gentle ones that you can do over there. Those are some hip range of motion exercises. I'll show 2 more stretches for the lateral muscles of the hip.